Hello, everyone. Welcome to this presentation. My name is Hussein Basma. I'm a prosthodontist and a board-certified periodontist, originally from Lebanon. And I'm currently a full-time assistant professor at University of Alabama at Birmingham. And before I start, I want to thank ITI for giving me the honor to be part of the ITI World Symposium 2021. And today I would like to share with you an over-radiographic methodology that helps evaluate ridge dimensional changes following bone augmentation procedure. So this started 4 years ago when I was a resident and I was working on my thesis, and we wanted to study the effect of allograft bone particle size and on the histological and the clinical outcomes following guided bone regeneration. So basically all the patients who were supposed to be included in this study, they were supposed to be healthy, they were non-smokers, and also they were treatment planned to receive an implant, but they didn't have enough alveolar ridge width. And we defined that in the study as insufficient alveolar ridge width that was less than 5 millimeter based on the CBCT. And if there was any vertical deficiency in that site, the patients were excluded. And once the participant met the exclusion-inclusion criteria, they were randomized in two groups. Group one, which is the small particles group that ranged between 100 and 300 micrometers, and the large particle group that ranged between 1,000 and 2,000 micrometers. After randomization, the patients were ready for surgery. All the patients received the ridge augmentation in the form of guided bone regeneration, where we opened a full thickness flap. And then after we opened a full thickness flap, we did a periosteal release in order to achieve a tension-free closure. We also did decortications, and depending on what kind of bone the patient was randomized in,